Postpartum hemorrhage, PPH, is severe vaginal bleeding after childbirth. It's a serious condition that can lead to death. Other signs of postpartum hemorrhage are dizziness, feeling faint, and blurred vision. PPH can occur after delivery or up to 12 weeks postpartum. Early detection and prompt treatment can lead to a full recovery. Get help right away if you're experiencing symptoms of PPH. So, let's discuss what is postpartum hemorrhage clearly. So, postpartum hemorrhage, PPH, is severe bleeding after giving birth. It's a serious and dangerous condition. PPH usually occurs within 24 hours of childbirth, but it can happen up to 12 weeks postpartum. When the bleeding is caught early and treated quickly, it leads to more successful outcomes. Postpartum hemorrhage is when the total blood loss is greater than 32 fluid ounces after delivery, regardless of whether it's a vaginal delivery or a cesarean section or C-section, or when bleeding is severe enough to cause symptoms of too much blood loss or a significant change in heart rate or blood pressure. However, what are the types of postpartum hemorrhage? There are two types of PPH. Primary postpartum hemorrhage occurs within the first 24 hours after delivery. Secondary or late postpartum hemorrhage occurs 24 hours to 12 weeks postpartum. However, why does postpartum hemorrhage occur? There are a few reasons why postpartum hemorrhage occurs. Your placenta attaches to the wall of your uterus and provides food and oxygen to your baby during pregnancy. After your baby is delivered, your uterus continues to contract to deliver the placenta. This is called the third stage of labor. Contractions also help to compress the blood vessels where the placenta was attached to your uterine wall. Sometimes, these contractions aren't strong enough to stop the bleeding, called uterine atony. This is the cause of up to 80% of postpartum hemorrhages. Postpartum hemorrhage can also happen if parts of the placenta stay attached to your uterine wall or if parts of your reproductive organs are damaged during delivery. You're at an increased risk for PPH if you have a blood clotting, coagulation, disorder, or certain health conditions. Who does it affect? Postpartum hemorrhage can affect anyone after childbirth. There are many risk factors for PPH, but approximately 40% of hemorrhages occur in women without any risk factors. Most postpartum hemorrhage occurs right after the placenta is delivered. PPH may be more likely after a C-section. How common and serious is postpartum hemorrhage? Postpartum hemorrhage occurs in about 1% to 10% of pregnancies. And postpartum hemorrhage is a serious and potentially fatal condition. With PPH, you can lose large amounts of blood very quickly. It causes a sharp decline in blood pressure, which can restrict blood flow to your brain and other organs. This is called shock, and it can lead to death. Postpartum hemorrhage is a medical emergency and needs to be treated right away. The causes of postpartum hemorrhage are called the 4Ts: tone, trauma, tissue, and thrombin. The most common causes of PPH are uterine atony. Uterine atony, or uterine tone, refers to a soft and weak uterus after delivery. This is when your uterine muscles don't contract enough to clamp the placental blood vessels shut. This leads to a steady loss of blood after delivery. Uterine trauma, damage to your vagina, cervix, uterus, or perineum, area between your genitals and anus, causes bleeding. Using instruments like forceps or vacuum extraction during delivery can increase your risk of uterine trauma. Sometimes a hematoma, collection of blood, can form in a concealed area and cause bleeding hours or days after delivery. Retained placental tissue. This is when the entire placenta doesn't separate from your uterine wall. It's usually caused by conditions of the placenta that affect your uterus's ability to contract after delivery. Blood clotting condition, thrombin. If you have a coagulation disorder or pregnancy condition like eclampsia, it can interfere with your body's clotting ability. This can make even a tiny bleed uncontrollable. How do I know if I'm hemorrhaging postpartum? The most common symptom of postpartum hemorrhage is persistent, excessive bleeding after delivery. Other signs of PPH are Symptoms of a drop in blood pressure like dizziness, blurred vision, or feeling faint. Increased heart rate. Decreased red blood cell count. Pale or clammy skin. Nausea or vomiting. Worsening abdominal or pelvic pain. Be honest with your healthcare providers about how you're feeling after delivery. In some cases, PPH doesn't cause symptoms until after you've left the hospital. Contact your healthcare provider immediately if you feel any of the symptoms above in the days or weeks after giving birth. How is postpartum hemorrhage diagnosed? Healthcare providers diagnose postpartum hemorrhage through visual and physical examinations, lab tests, and a thorough review of your health history. They may detect postpartum hemorrhage based on the amount of blood you've lost. Measuring the volume of collected blood and weighing the blood-soaked pads or sponges from delivery is one common way to approximate blood loss. Other methods to diagnose PPH are continual monitoring of your pulse rate and blood pressure to detect problems, blood tests to measure red blood cells, hematocrit, and clotting factors, ultrasound to get a detailed image of your uterus and other organs. However, remember, postpartum hemorrhage is a serious condition that requires medical attention as soon as possible. Contact your healthcare provider immediately if you're experiencing severe bleeding after childbirth. Other signs of postpartum hemorrhage are dizziness, feeling faint, and blurred vision. Early detection and prompt treatment can help prevent complications. It's important to be open with your healthcare provider about your medical history so they can determine if you're at higher risk for postpartum hemorrhage. Please, if you don't subscribe to my channel, so please subscribe for more informative content, and thanks for watching. Until next time.